Hi everyone, good evening. Today we are very happy to have Dr. Madhu Gulati ji with us. She's a very senior obstetrician and gynecologist practicing in Gorakhpur city of Uttar Pradesh. For the first 10 minutes, she'll be explaining about thyroid in pregnancy, how to take care and how to avoid thyroid in pregnancy. She'll give us 5 important tips. And after that, she'll take all your questions. Please post your comments, questions in the comment section. Happy to have you today with us, Madhu ji. Please continue, over to you.
Hello, everybody. Thank you so much, Dr. Jaideep Malhotra and iMumz for having me here this evening. I'm really very happy to be here with you all. And I think iMumz is a fantastic app, and especially it's doing so much good for all the patients in this lockdown phase and this corona phase. Patients are not able to reach to their doctors, so this app is really helping them a lot. And in fact, I feel that in this corona phase, corona pyar hai, that is what I call it. We should all be giving a lot of love to ourselves, lot of care, lot of self time for our own selves, and doing what we have never been able to get time to do. Working women have now got a lot of time at home, and even the home ladies have also, got time with their husbands and children. So take this time to be with your family, to be with your loved ones, do what you want, and believe me, this too shall pass. If we remember this and be happy and positive, this too shall pass. And today I've been told to speak a bit about thyroid dysfunction in pregnancy. And thyroid disorders are the second most commonest disorders after diabetes in pregnancy. And there are two types of disorders. First, let me tell you that thyroid is a small butterfly-shaped gland in the neck region, and it secretes a very important hormone called thyroxine. This hormone is very crucial to the well-being of the entire body, and a decrease in the hormone leads to hypothyroidism, and an increase leads to hyperthyroidism. So what is hypothyroidism? When the hormone level, the TSH increases, the thyroxine hormone decreases, then we take it as hypothyroidism. And a patient may come up with loss of appetite, weight gain, and not able to sleep. Or in hypothyroidism, she'll be feeling very sleepy, and there'll be intolerance to heat. Then skin will be coarse, there will be hair falling of hair and things like that. So, and in hyperthyroidism, she would be irritable, she would have insomnia, she would have loss of weight, diarrhea, and so we have to decide first that how we have to go about diagnosing this and how we have to treat it. When a pregnant lady comes in her first visit to the hospital, apart from blood group, apart from the various tests as hemoglobin and the viral markers, we have to get her TSH level done. And TSH should be done on an empty stomach. Patient should come without even having tea, because the milk in the tea can cause differences in the reporting. So it should be done empty stomach. And the level in the first trimester, thyroid level is around, we keep it around 2.5 milli MIU per liter. In the second and third, it is around 3. So we maintain it at that level. An increase above 10, then we treat it as hypothyroidism. and the patient is put on uh, levothyroxine and given in the uh, dose of 1.6 to 2 MIU per kg. And we also have a system where it is between 4 to 10, and at that stage she may be a subclinical thyroidist, and in that patient we do a TPO antibody, and if it is positive we put her on Eltroxin or one of the brands which are available. A TPO antibody has to be done only once in the entire uh, pregnancy, and TSH levels should be repeated at least 6 to 8 weeks till term, and then can be decreased after postpartum, and then tested again after 6 weeks. Sometimes what happens is when a patient is already having uh, hypothyroidism and she comes to you, then her dose should be increased by at least 30% immediately, and then maintained according to the guidelines. A lot of patients who are hypothyroid sometimes panic that my levels are not controlled and do I need to go for an abortion and things like that. But that is not necessary. One can control the dose unless she is gravely uncontrolled hypothyroidism. Then there may be problems with the fetus. And why are we so particular about testing about TSH levels? Because it can cause missed abortions, recurrent abortions, small for date babies, IUGR, and then uh, preterm labor, preeclampsia, gestational diabetes, PPH, uh, and a whole lot of things. So it is very important to get your thyroid testing done. A lot of patients say that, मैडम जी आजकल थायराइड बहुत बढ़ गया है, ऐसा क्यों हो गया है? So basically the thing is that the awareness has increased and the testing facilities have now become available and they have become cheaper. So we do testing on the whole group of patients and then pick up those latent cases of hypothyroidism. A lot of patients asked are what should we eat and what precautions should we take. So one should avoid cabbage, broccoli, Brussels sprouts, cauliflower, then soya beans, soya milk, soya bean products. Also, along with that, uh, fried food, oily food, starchy food should also be avoided, and caffeine and alcohol should also be avoided in those patients who are on uh, Eltroxin or hypothyroidism medication. And once a patient delivers, her TSH, her dose of Eltroxin can be reduced to pre-pregnancy level, and then she can go for a testing 6 weeks later. Sometimes when the patient is on very high uh, levels, doses of hypothyroid medication, then her pediatrician decides that when the baby's TSH levels are to be done, and they're normally done about 4 or 5 days after delivery and then followed up after 6 weeks. If untreated, the baby may have delayed milestones, may have a little memory, uh, uh, may have some memory issues and some cognitive problems. So, but these days, those cases are very, very few. Earlier, cretin babies used to be born, but now with better ANC facilities being available all over, such cases are very, very rare. Hypothyroidism is more common, while hypothyroidism is quite uncommon. Only 0.2% of patients come up with hypothyroidism. So these patients are put on propyl thyrouracil in the first trimester and then switched on to methimazole or carbamazole after once the second trimester shifts. So hypothyroidism patients should always be referred to an endocrinologist for their dose regulation and for the management. And and normally these patients, because these drugs are a little toxic, we would want them to get euthyroid as soon as possible and the doses to be reduced to the minimum required level. So what else should I tell you all about thyroid dysfunction? Besides these two conditions, there are other autoimmune conditions like Hashimoto's disease, Graves' disease, thyroid adenomas, thyroid carcinomas, which are also seen. And earlier we used to see those large goiters in the country, especially in Eastern UP, it was very common. These days we don't see so much of that. But of course, a lot of patients are, when we do a survey, sometimes we have a free camp in the hospital that today we are getting your thyroid levels done, today we are getting your blood sugar levels done. And a lot of people, their attendants get their check done. And a lot of asymptomatic patients come up with raised levels of TSH, and then they are diagnosed and put on medication. Eastern UP, where I stay, it is very common to have patients with hypothyroidism. I think the soil is deficient in iodine here. Of course, these days we do have iodized salts also, and that helps in keeping your iodine levels in the body. But it does run in families. I've seen sisters, mothers, daughters having the same problem. And even if you are a young girl, you may have thyroid problem, uterine dysfunction, bleeding problems, then difficulty in conceiving. It is one of major causes of patients wanting to conceive. They have irregular periods, they are not able to conceive. So thyroid is an important issue and it is there to stay. And I think even if you're not pregnant, once you get your yearly, everybody should get your yearly checkup done, your blood sugar, your blood pressure and your thyroid levels to see if you're fit and fine. And what else should I talk about thyroid? Is it 10 minutes?
Many people, they want to know about their own condition, doctor.
Pardon me?
काफी लोग जिनका या कैन यू हियर डॉक्टर काफी लोग जिनका थायराइड समस्या है वो पूरा आपसे जानना चाहते हैं अपनी समस्या के बारे में जी
बताइए
फर्स्ट क्वेश्चन वी हैव फ्रॉम जानवी राणे जानवी राणे is 25 weeks pregnant. She's having hypothyroidism since 2 years and she's on the medicine Thyronorm 12.5 mcg. Now she's taking 25 mcg, but due to lockdown her sleep pattern got disturbed. The medicine is not fixed. So she's asking you for a suggestion.
Sleep pattern has got disturbed because she's sitting at home and she's not too active. Is that one cause of her sleep pattern getting disturbed? Or she's too much on her mobile and Netflix and TV? So that is causing her sleep pattern to get disturbed. When was the last time she got her TSH level done?
That details she didn't mention, madam.
Hello?
Yeah.
When was the last time?
Those details were not mentioned. Janvi, if you're watching this live, can you please mention when was your last TSH done? Shall we take next question by then, doctor?
Yeah.
Yeah. So Kavya has a question. Please explain about sleeping and sitting positions during each trimester, as we have many myths around the same. Is sleeping on the back is good in the second trimester?
See, first and second trimester, there are no issues. You can sleep in whichever position you are comfortable at, and you while sitting, one should sit erect. Your spine should be erect. One should not slouch and sit. That is not a good posture. But in the last trimester, left lateral is the best posture because that increases the blood flow to your fetus. So that is the best posture. But then there are some people who say, I can't sleep, Karvat say, I can't sleep Siddha, I can't sleep like this, I can't sleep like that. So then in the end, in whichever position you are comfortable and you are able to sleep well, that is the best posture for you.
Thank you, doctor. Our next question we have from Yummy Mummy. She's asking how to have pregnancy with high BP and diabetes.
What is your age?
Can you please mention your age?
Your age, Yummy Mummy.
We'll take next question. Shweta Rajendra's question. I'm 7 weeks, 6 days pregnant. My TVS shows yolk sac 0.38 centimeters, CRL 0.82 centimeters. Is it fine? Or should I be worried?
What about the cardiac activity? Cardiac activity. You should have a cardiac activity at 7 weeks, 6 days. You've not mentioned that.
Yeah, she didn't mention. She mentioned about yolk sac and CRL levels.
No, but what about cardiac activity? That is more important.
Yeah, that she missed it, madam. If you're watching live, can you please mention Shweta Rajendra? Pavana Anand has a question. Hi, doctor. I'm 26 weeks pregnant. I was diagnosed with hypothyroid before pregnancy and I was on 88 mcg dosage. The dosage was increased in second trimester to 100 mcg. Will I go back to 88 mcg after pregnancy?
If your TSH levels are controlled and you're in your second 26, you should be at around 3. Your TSH level should be around 3 MIU per liter in the second trimester and third trimester. And if you're controlled on that with 100 microgram, then you will be able to go back to 88 after your pregnancy.
Thank you so much, doctor. Back to Shweta Rajendra's question. She can see the cardiac activity.
Then it's fine. There's no problem.
Yeah. And she's also asking how to increase the amniotic fluid level.
Amniotic fluid level at the moment is, we don't, unless there's a discrepancy between the CRL and the gestational sac, that is nothing to worry about. At 7 weeks, the amniotic fluid level is not a thing to be bothered about.
So good luck, Shweta Rajendra. Next question by Mona Sharma. Hello, ma'am. I'm 19 weeks pregnant. I take Ecosprin 150 tablet daily, but due to that, I feel severe heartburn and acidity. Is it necessary to take the tablet daily?
Are you? Have you had a incidence of any preeclampsia in your last pregnancy, or are you hypertensive? Is there any history like that? If you're not, you can reduce it to 75 and see whether it suits you and you're not having heartburn. You can reduce it to 75 then.
Yeah. Thank you so much,
Or you
doctor.
can take it in divided doses. Instead of 150 milligram daily, you can take it 75 twice a day.
Yeah. Thank you, doctor. Actually, Dr. Jaideep ji and Dr. Niharika Malhotra are also watching this live. They both are welcoming you. Jaideep ji commented,
thank you,
welcome Dr. Dear Dr. Madhu. And Dr. Malhotra commented, hi Madhu aunty.
Hi, Niharika. How are you?
Yeah. So next question we have from Gangotri Das inside the iMumz app. Hello, ma'am. I'm 25th week pregnant. I'm getting pain at my pubic bone and it is very uncomfortable. I did a cervix gland scan. Everything is fine, but still the pain is there. I'm also having burning sensation at my feet continuously.
Okay. Um, Pubic bone pain is usually because of the stretching of the uh, pubic symphysis, the fibrous tissue there starts stretching, so you feel a little bit of pain. It could also be because of low vitamin D levels. And if you're having burning feet syndrome, you could be low on your other vitamins, especially vitamin B12. So, if possible, get your vitamin D and your uh, vitamin B12 tested, and also your urine tested done. And take a lot of fluids.
Thank you so much, doctor. काकाशान अंसारी's question is, मैम मैं 34th वीक प्रेग्नेंट, मेरे पैरों से टिंगलिंग एंड स्क्रैम की प्रॉब्लम है, क्या करूं? बिल्कुल भी चल नहीं रही मैं, पहले कोई बीमारी नहीं थी, 1 मंथ से ऐसा है, प्लीज कुछ सजेस्ट कीजिए. शी इज 23 years old.
She's 34 weeks pregnant and पैरों में
Yes.
tingling
Yeah.
and cramps की प्रॉब्लम है. Okay.
Yeah.
बिल्कुल भी चल नहीं पा रही हूँ. She needs to go and show a doctor as soon as possible. Maybe she's becoming hypertensive. बिल्कुल नहीं चल पा रही हैं. Whether she's got pedal edema and पैरों में tingling है, so she can take there are drugs like Neurokind LC, like Evion and Coringa, which all help in cramps. And but at 34 weeks, she should go to a doctor as soon as possible and take a consultation.
Thank you so much, doctor. Sasana Asha asked question. Hi, ma'am. I'm 19 weeks pregnant. But since starting, nor I have experienced any nausea or vomiting or morning sickness, neither any food cravings. I'm worried if everything is okay with my baby.
You're the best patient I've heard of. No problems, no pain, nothing. You just eat well, sleep well, take the medications prescribed by your doctor, go for your 20 weeks to 22 weeks congenital scan, and I'm sure you'll come out sailing throughout your pregnancy. The patients who are very positive, who have no complaints, or who have mild symptoms but still are very happy, they have the best pregnancy outcomes. So you needn't worry. I'm sure everything is fine with you.
Yeah. Thank you so much, doctor. Next question we have from Zehra Syed inside the iMumz app. Hi, Zehra. IVF pregnancy 9 weeks long. How to take Lonopin injection? My doctor said till 8 months. Till 8 months, the injection has to be taken. I'm taking on abdomen. My abdomen gets tight. Will that have side effects later? And
It won't
taking.
have any side effects. You can take it on the abdomen. You can take it on the thighs. You can, alternate with it, one arm, the other arm, abdomen, one thigh, other thigh. Sometimes there are some brownish, reddish bruises, but it will have no side effects and nothing to worry about it.
Thank you, doctor. And she has also asked, is this injection necessary? Anticoagulant was 15.4.
Can you repeat the question?
She's asking, are these injections, taking these injections, is it necessary? She mentioned anticoagulant was 15.4. I don't know what it is. COLUNGANT and anticoagulant was 15.4, she mentioned.
Since her doctor has advised and she's an IVF pregnancy, she should take it till at least 36 weeks. 34 or 36 weeks till the time her doctors have advised not to stop it right now.
Yeah. Thank you, doctor. Next question we have from Sudarshan Chakravarti, my wife. TSH is 4.79. She's in her 8th week of pregnancy. She's taking Thyrox 75, and now she's taking Thyrox 100. Is there anything to be concerned about?
Nothing to worry at all. Nothing to worry at all. Nothing to worry. Just keep getting her TSH levels done every 6 weeks.
So good luck, Sudarshan ji. Next question we have from Neha Sharma. Hello, ma'am. I'm 24 weeks pregnant with thyroid. I'm unable to go for the 6th month checkup and ultrasound because of the lockdown. What should I do in this situation?
I'm sure after the 4th, maybe if you're in the orange zone, you would be able to go for your checkup. Just have your regular medication which you have been prescribed. And if you have started perceiving quickening or your fetal movements, just see that you're having that quickening. Don't worry. As soon as the lockdown opens, you can go for your checkup and scan. Don't worry.
Yeah, so we're taking Janvi Rane's question we missed already. She took the last thyroid test on 7th February and the TSH level was 1.25. After that, she has not done any TSH. And currently, she's taking Thyronorm since 2 years and she's on 12.5 mg but now taking 25 mg. And currently, her sleep pattern is disturbed and she is 25 weeks pregnant.
But her TSH is how much? 1 point something.
TSH is 1.25 on 7th February. Post that she is unable to get her TSH checked again.
And she's taking 25 now.
Yes, doctor. She's taking
So
25.
maybe if after the 4th, if she can get it checked, and we would want it to be around 3. So if she can, either she reduces her dose or if we can get it checked within a week, it will be good. It will be better because it's already February, March, April, May. It's been nearly 3 months now. She should get her testing done.
Yeah. So please get your testing in January. All the best. Next question from Deepthi Bhalla. She's 6 weeks pregnant and the thyroid is 7. My thyroid doctor told me to abort child's IQ will be very low. I have thyroid history. Earlier I take 125 mcg, but now taking 150 mcg thyroid norm. She's asking you for a suggestion.
No, I don't think she should abort her child. We have had patients who have been taking 125, 150, even up to 200, and they have delivered normal, healthy children. And her thyroid is only 7 at the moment. I don't think she should abort her child.
Thank you so much, doctor. These answers actually are very, very helpful. There are so many myths and thyroid being such a common problem. Your answers are very, very helpful for everyone, madam. In fact, Dr. Jaydeep ji put a comment, great session, Dr. Madhu. Thyroid problems are so common and so many misconceptions and myths. Thanks for clarifying them. So stay assured, everyone. Deepthi Bhalla, as doctor said, you can have your happy pregnancy. This is coming from an expert with decades of experience. Next question from Anu Patil. She's in 16th week of pregnancy and she detected hyperthyroidism and doctor suggested for a surgery.
Did you meet an endocrinologist?
Yeah, her question is continued, madam. She lives in Norway. She's 16 week pregnant and detected hyperthyroidism and the calcium is very high. Now taking Glivaxin 125 mcg and doctor says that she has to undergo through a surgery.
I will, very frankly, I will not be able to advise you on this particular condition, that surgery during pregnancy. I'm sure you must be in the best of hands and in best of good endocrinologists must be taking care of you. But really, I will not be able to advise you whether you should go through surgery at the moment or not. I'm being very frank.
Thank you so much, doctor. Next question we take from Lakshmi Kumari. She's having hypothyroidism from last year, she mentioned. Now it is 4.5. She's using 88 mcg tablet now. Currently, she's in 3rd week of pregnancy. She's having lower abdominal pain. Is it normal? Is it common to have?
A lower abdominal pain, there can be a lot of reasons, a little bit of gas, a little bit of constipation, and early pregnancy. There are so many hormonal changes happening in the body, so you can land up with a little bit of pain. Maybe you have a little bit of urine infection. A lot of causes for that. Nothing to be worried about your thyroid about. I mean, it doesn't have to do with your hypothyroidism.
Thank you, doctor. Aarti has a question. Hello, doctor. Please suggest me what should I do to control my hunger. I'm 17 weeks pregnant. I feel so much hunger, and when I eat anything, then my stomach gets bloated. I feel so much tired due to it.
Do you have a history of diabetes in the family? Or have you got your thyroid and your levels done?
Those details were not mentioned. Can you please mention, Aarti, if you're watching this live?
If you feel hungry, you have to have a balanced diet because otherwise you will just put on excessive weight. So, apart from having iMumz gives you a lot of information on balanced diet and what you should be having, and if you're feeling hungry in between meals, what you should have at that time. You could follow that. You could take the advice of the dietitian on this app and all the diet plans they have. But binge eating would be harmful for you. And
So,
if you have to eat something, take something which has a high protein value and gives you a lot of, take some fruits, which gives you a lot of minerals. I would not want you to take chocolates and mithai and things like that.
thank you so much, doctor. Actually, Aarti mentioned that her mother has a diabetes problem.
Okay.
Aarti,
So you should get your fasting blood sugar and your PP blood sugar and get your thyroid level done also. And there are a lot of tests for blood sugar, like 2 hours, but I'm not sure whether at the moment you'll be able to get it done. So if some lab is open or can take home collection, fasting and PP at the moment would be all right for you.
thank you so much, doctor, for suggesting. Aarti, you can also check out iMumz dietitians we have. They'll be, sit with you and check out a detailed diet plan for you, as Dr. Madhuji has suggested. Next question we have from Deepthi Rani. She asked this question inside the iMumz app. She is 19 weeks pregnant. Sorry, 20 weeks pregnant. Her thyroid is 5.45. The third month scan says she have hemorrhagic cyst dermoid. Kindly tell me about this. Also,
This
TSH.
is the scan is not very clear whether it's a hemorrhagic cyst or a dermoid. And since you're pregnant at the moment, and if you have no problems, you needn't worry. It will, if it's a hemorrhagic cyst, it may dissolve on its own, and a dermoid cyst will also not cause any problem. I have operated on a patient and discovered a bilateral dermoid cyst on the OT table and then removed them. So you needn't worry. If you're not having any severe pain, if you're not having any severe, excruciating pain in any time during pregnancy, then you needn't worry. Dermoid cyst may or may not increase, and the hemorrhagic cyst usually decreases.
Thank you so much, doctor. Thank you, Aarti, for your wonderful comment. We are very happy that we are helpful. Next question we have from Parameshwari. She is saying that she have left side fallopian tube block for the past 3 months. She's trying to conceive, but she couldn't. Is operation is safe?
Always get it done after the lockdown and see the status of the other tube. Sometimes the blocked tube also reopens, and the exact status of your tubes, the uterus and the ovaries will be checked, and then accordingly treatment would be advised to you. But I would suggest you get it done after the lockdown opens.
So Aarti has another question. She's also having a problem of bleeding gums. She is not able to chew fruits and salads. Is there any problem? Aarti
She's
is in,
pregnant, huh? Aarti
yeah,
is
she's
pregnant.
17 weeks pregnant. Yeah, madam.
Yeah. So sometimes pregnant patients land up with gingivitis, and at the moment, what I can advise is tell her to take vitamin C, and if fruits and salads, if she's not able to chew, she can take smoothies, and but she should start taking vitamin C.
Thank you so much, doctor. Next question we have from
Pregnancy
Yamini.
gingivitis is quite common.
Yeah, so take care accordingly, Aarti. Next question we have from Yamini. She's 10 weeks pregnant. During the 8 week, she tested, blood test found hypothyroid 7.5. The doctor suggested thyroxine 25 mg. Is this dosage enough? She's worried if the TSH is high. She don't have any thyroid history before pregnancy.
It's not necessary that you have thyroid history. A lot of, like I said, a lot of patients are diagnosed only when they come in their first pregnancy. And usually we give thyroxine according to the body weight. It's between 1.6 to 2 microgram per body weight. So I'm sure your doctor must have calculated and given you accordingly. And you can always get the test repeated after 6 weeks to see whether your
Yeah.
thyroid level is normal now.
Thank you, doctor. Next question we have from AJ. Ma'am, I'm 11 week pregnant, but due to lockdown, I didn't meet any doctor, and I'm not consulting any doctor, and not took any vaccine yet. What should I do?
You don't need vaccine at present. If you could get folate or any folic acid uh, medication from some drugstore, I would suggest you just take that. And once your lockdown opens, you can go and meet a doctor and get the necessary blood tests done and the ultrasound done, and all the other requisites could be done given at that time.
Thank you so much, Doctor. Soumya Gulati has a question. Hi, doctor. I'm 25 weeks pregnant. My placenta is low lying. Are there any chances for the normal delivery?
My 11 weeks pregnancy and
She's
placenta low
25
lying, I won't
weeks pregnant,
bother a
doctor.
lot about it, because placenta usually grows, and most of the cases, as the uterus grows, the placenta goes up.
Yeah.
If in the ninth month, after 36, 37 weeks, placenta is low lying, and it depends where is it exactly it is. It's, reaching the os, covering the os, or tipping into the lower segment, and a lot of other issues that define whether you can go in for a normal delivery. I would just tell you to relax at the moment. Don't lift heavy weights, don't climb up the stairs 10 times a day, and just take a chill pill.
Thank you, doctor. Intentionally because we don't want to talk about any specific brands. So you can ask this question with your friends in the feed, and they might, share some good brands they're using. S Singh has a question. I'm 28 week pregnant. My post glucose sugar after 2 hours is 153. I'm a little worried. Doctor recommended regular diet for 1 week and take the sugar test. I'm trying to control. Please give your suggestion.
Don't worry, just cut down on your sugar. Take green tea or lemon tea, or a tea without sugar, and I'm sure it'll be all right. You could do a little bit of walking. No sugars, no pastas, no pizzas, no maida wale things, and it is not alarming. Don't worry, you'll be fine.
Thank you so much, doctor. Next question we have from Shahrukh Abdullah. Hi डॉक्टर, मेरा 15th वीक चल रहा है. मेरा अभी तक कोई स्कैनिंग या टेस्ट नहीं हुए हैं. मैं कुछ करवाऊं क्या?
You need to get a ultrasound done around 20 weeks, 18 to 20 weeks, congenital anomaly scan. And at the moment, whenever you are able to go for a checkup, I would recommend you to go. I mean, we don't advise very frequent checkups to the doctors during this lockdown phase. One checkup in the first trimester, another around 20 weeks, and then around 28 weeks. So too many frequent checkups to the doctor are not advised at the moment. If you haven't had a checkup at all, then you could go for one. Otherwise, when the lockdown opens and in your area, you could go for a checkup.
Parameshwari earlier, who asked about fallopian tube block, she's asking what are the solutions for hydrosalpinx. In case of operations, what is the possibility of pregnancy?
See, hydrosalpinx occurs when the tube is damaged. So even if a laparoscopy is done and a lateral salpingostomy is done, or a linear nick is made on the tube, it is still a damaged tube. And there are more chances of ectopic pregnancy in that. So for hydrosalpinx, if it is bilateral, I would advise drainage of the fluid, clipping of the tubes, and then to go in for ART procedure if needful.
Thank you so much, doctor. Next question we have from S. Singh. Her doctor also, one second. She's 28-week pregnant and she mentioned about the post glucose sugar after 2 hours is 153. Her doctor also recommended progesterone Pro 9 injections every week. It's 28-week till now. Till how many weeks can she take? Doctor recommended for 3 more weeks. Is there any issue?
I don't think you need progesterone injections right now, unless you've had a history maybe of preterm delivery or some other problem. But normally we don't give progesterone injections till 28 weeks. I normally don't recommend.
Thank you, doctor. Shweta Rajendra again asked this question, ma'am, how to increase amniotic fluid in the 7th week?
7 weeks amniotic fluid is not an issue at all. Amniotic fluid is counted, at 28 weeks or so. At 7 weeks, it is not an issue at all. Unless the gestational sac, the CRL is, measuring 7 weeks, and the gestational sac is measuring 5 weeks, 0 days. There's a crown gestation sac CRL discrepancy. That is a different issue. But at 7 weeks, you don't have to bother about amniotic fluid.
She mentioned the yolk sac as 0.38 centimeters, CRL as 0.82 centimeters, and there is cardiac
it's fine. A cardiac activity is there. It is fine.
Yeah,
nothing
so
to worry.
Shweta, there is nothing to worry. As doctor said, amniotic fluid is not a concern at this stage of pregnancy.
No
enjoy your pregnancy. Follow the exercises in the baby care program of iMumz.
Yeah, just follow iMumz. You'll be all right.
Yeah. So you have the advice, just follow iMumz and you will be all right. So some handle asked the question, I am 17th week pregnant, having sugar, please suggest sugar-free health drink.
Sugar-free health drink. At the moment, you can have, summers are around, you can have a detox health drink. You can add oranges and ginger and lemon and pudina into it. Or you can add pomegranate, a mixture of water is available at home. Pomegranate, and then again ginger, lemon, and there's so many, mix and match of these fruits which you can take. Don't take ruh afza, don't take khas, don't take lemonade with sugar, don't take fruity and Coca-Cola and things like that.
Yeah, so stay healthy, stay safe. Next question, madam, we have from Madhu Gulati again. She's 25 weeks pregnant. She's asking any scans to be done after level 2 scan. Any ultrasounds after level 2?
No, next scan would be at around 28, 30 weeks. 32 weeks. Not right now. If you've had your level 2 scan, you don't need a scan right now.
Thank you, madam. Rishita Gulabani has a question. She's in 9th week of pregnancy and yet to have any scan. Is it okay if she get it next month once the lockdown is over? And please suggest proper sleeping position. She's not able to have a good sleep. She's sleeping.
She can get a scan once the lockdown opens. No issues.
Yeah. Okay, you can get that. Another part of her question, she is not able to sleep in the night. Sleeping. Okay, one night I'm sleeping, next 2 nights I'm up and hardly able to sleep.
So then she must be sleeping in the day. Is she sleeping in the day?
Are you sleeping in the day, Rishita? Please mention if you watching this
She's
live.
not sleeping in the day also.
No, that detail she didn't mention, madam. She is talking about.
So she must be on WhatsApp, on Netflix, or on the TV, or on her phone the whole time, because you must sleep, switch off your phone at least 2 hours before you sleep. But what
Yeah.
we do is, even if we get up at the middle of the night to go to the washroom, we switch on our phone. So that should not be done. She should switch off her phone
Yeah.
at least 2 hours before. She should not have coffee or tea in the evenings, because coffee is a stimulant, and it will your sleep gets hampered. She should not do that. And I would like to know what is her daily activities. Why this is has she having some stress related factors, or what is her what is her daily activities that she's not being able to sleep at night.
So Rishita, please take care of your daily activity. And iMumz has a yoga nidra section, and we have calming music depending upon your stage of pregnancy. You can follow them as well. Many women have shared that these exercises are helping them a lot to sleep better.
Yes,
Next,
yes.
yeah, man. Next question we have from Goblikar Shravani. Good evening, madam. I'm in 23 weeks of pregnancy. I'm suffering from leg pains and back pain.
uh, Leg pain and back pain, there are a lot of exercises in the app which will help you for your leg pain and back pain. Are you taking calcium or not? Are you taking calcium or not?
Yeah, please mention Shravani if you're taking calcium.
And there are
Shall
a
we?
lot of exercises which will help you with your leg pain and back pain.
So,
You don't know.
Rishita, who asked the question earlier, she mentioned that she's not using the mobile much, and she's facing, her hands and legs are shaking and sweating due to the lack of the sleep, and she's
Then she
not.
must go to a doctor, get her checkup done, get all her blood tests done, and then take the appropriate medication. Because
Yeah.
if
So
they're
please take
shaking
care,
and
Rishita.
they're sweating, she must go to a doctor and get
Yeah.
her full checkup
Please
done.
consult your obstetrician, Rishita. Next
Yeah,
question by Lal
right.
Tomato. डॉक्टर आई एम 8 वीक्स प्रेग्नेंट मुझे नॉसिया फीलिंग बहुत ज्यादा है पर वॉमिटिंग नहीं है किसी ने मुझे बताया है कि होम्योपैथिक R50 यूज करूं से नॉसिया ठीक हो जाएगा क्या मैं यूज कर सकती हूँ
I will not be able to tell you anything about homeopathic medication. We do have some very good medications in our field which are good for nausea. And if you don't want to take medication for nausea, you can always, कोई मुख श्वास ले लो, इलायची मुंह में डाल लो, चूरन मुंह में डाल लो, कुछ आंवला कैंडी मुंह में डाल लो. There's so many things which we have in our daily घर के नुस्खे which you can use if you don't want to take medication. But I don't have any idea about homeopathic medication, so I won't be able to advise you.
एंड शी इज ऑल्सो सेड मुझे फ्लू और स्नीजिंग भी है मैं यहाँ जर्मनी में हूँ डॉक्टर्स मेडिसिन भी नहीं देते जल्दी मैं क्या करना चाहिए आई थिंक यू ऑलरेडी आंसर दैट क्वेश्चन
It could be just a mild passing phase, flu and sneezing, and it should pass off. I mean, if you are running temperature more than 100, तो फिर आपको क्रोसिन लेना पड़ेगा. But otherwise, जो जर्मनी का जो प्रोटोकॉल है, आपके वहाँ के जो डॉक्टर्स का प्रोटोकॉल है, वो आपको फॉलो करना पड़ेगा.
Thank you so much, doctor. Next question is from Sona. She is 7 weeks, 4 day pregnant and feeling pain in the breast. She have fibroid cysts in both the breasts.
During pregnancy, especially the first trimester, last trimester, the breast enlarges and the breast tissue, starts preparing itself for lactation. So if you already have fibrocystic breast disease, you will have a little bit of pain, but as we will not be able to give you some medication for that.
Thank you, doctor. Next question from Shika Naidu. She is 8 weeks pregnant. She had a miscarriage in December 2019. She's taking Susten 200 mg and folic acid tablets. She had white secretion and cramps few days ago. Till ultrasound is not done, should she be concerned?
She's taking sustain and she's
Sustain
taking
and
folic
folic
acid.
acid, yeah.
Hmm.
No ultrasound done so far. She's 8 weeks pregnant with a history of previous miscarriage in December
She
2019.
should go for an ultrasound because she's got a history of previous miscarriage.
Yeah, so please consult your nearby doctor. Next question we have from Mayuri Prakash. She's 14 weeks pregnant, having short cervix, 24 What to do?
Do you have a history of a previous abortion, mid-trimester abortion or some abortion?
No history
Do you have a
mentioned.
history?
No history mentioned. 14 weeks pregnancy she's in. Mayuri, if you're watching
She
this,
should go in for a circulage because it's 24 She should go and show her obstetrician, who will be the best person to tell her, but I would advise her a circulage.
Doctor, next question from Deepika Juneja. Hi, I'm 36 week of pregnancy, but placenta has matured. That is grade 3. When do you think we can expect delivery?
It depends on a lot of factors, whether what is your AFI, the Leica volume, the blood flow in the umbilical vessels. So there are a lot of things. You just can't go on one thing that my placenta has matured. A lot of patients have early maturation of placenta, but then we tell them to take care whether they're having adequate fetal movements, what is the color Doppler studies report, and then go ahead with that.
Thank you so much, doctor. Next question is from Divya Reddy. She's 21 weeks pregnant. She got NIPT test done because doctor said nasal bone is not visible. After 4 weeks of repeated scan, they said ossified nasal bone, NIPT risk is low. Please explain what does it mean.
Actually, at that time, the nasal bone was not visible. Now they're saying ossified nasal bone. That means that the nasal bone has developed and it has ossified. The calcium depositation has happened, and the nasal bone is that is a technical term, and the nasal bone is visible, and your NIPT risk is low, so there is nothing to worry. Nothing to worry at all.
Hey, doctor. Sonali has a question. She's 27 weeks pregnant. I have RLS while I sleep at night in my hands and legs at night. I'm having calcium, and along with that MACD3. I'm having thyroid 100 mg daily. I'm just not getting sleep.
What is RLS?
Restless, I guess.
Huh?
I don't know. I'm not sure. Restless maybe.
Restless maybe. Tell her to go on to app. There's so many nice, soothing, music and so much of to relax and to help her to sleep. She should go onto the app and follow those music there, which will help her relax and get some sleep.
RLS means restless leg syndrome, it seems, doctor, she mentioned.
There's so many things in the app which will help her.
Yeah. So Sonali, you can check out Yoga Nidra in the app, and music, pregnancy music, month-wise classical music, relaxing one in the app. And there are many meditations as doctor has suggested. So Neha Tanwar's question: I had taken antibiotics prescribed by gynecologist when I was 3 months pregnant. I'm skeptical if it can affect the baby's development. Please clear my doubts. She didn't mention her gestational age.
I'm sure your gynecologist must have given you antibiotics which are safe in pregnancy. No gynecologist would give you an antibiotic which is not safe in pregnancy. So just relax. Don't, get stressed on that. I'm sure nothing will happen to your baby's development.
Yes, Ruby, we're taking questions inside the iMumz app and on the YouTube channel and Facebook. I didn't come across your questions. If I missed, can you please post again? I can't find your question. So another question we have, madam, in the iMumz app, Deepthi Rani, she asked you a question regarding the cyst problem and the left abdomen pain occasionally, and the pain in the pelvic region due to hemorrhage or dermoid cyst.
Yeah.
Yeah. So does this occasional pain on abdominal is a matter of concern due to the hemorrhage or dermoid cyst? She's in 20th week of pregnancy.
So she's not having severe pain, occasional pain.
Yeah, occasional pain, yes.
So nothing to worry. If she has severe pain, then she'll need an emergency operation. If it's occasional pain or a little bit of, heaviness in the lower abdomen, she doesn't have to worry.
Yeah, Ruby Mishra, I still can't see a question. Can you please post it if I missed it by any chance? It's on the YouTube before Mayuri Prakash. No, not before Mayuri Prakash. Okay, I'll just check it. Okay, so sorry, Ruby, I got it now. So one question from Ruby. I'm 12 weeks pregnant, taking Thyronorm 25 mg since 4th week due to raised TSH up to 5.2. Can this medicine be stopped after pregnancy?
Yeah, if your thyroid level comes down, it can be stopped.
Yeah. Thank you so much, Doctor. You have been patiently answering and giving us knowledge from the past 1 hour. We still have 5-6 people waiting for your answers. Can we take last 2-3 questions, or should we wind up the session? It's up to you. I mean, if you have 5 more minutes of time, shall we take 2 more questions?
Sure. No issues.
Thank you so much, Doctor, for accommodating this request. Next question. Okay.
Poorly ossified.
Yeah.
Okay.
Ankit Srivastav is asking, my wife is 30 weeks pregnant. Are there any tests or scans to be done after the color Doppler? Do short height, which is 4 feet 10 inches, have any effect on type of delivery? Hello? Doctor, can you hear us? Hello? Hello? Uh, I, Hello, doctor? Hello? Yeah, I think we missed connection. We just wait for 1 more minute for Dr. Gulati ji to join. Meanwhile, I request everyone to check out the iMumz app. There is a beautiful video which is done by 60 plus gynecologists across the country. They dance to a beautiful song called Happy, just to put a smile on your face. Now we started a beautiful movement where we ask you to share one of your dance moves for 10 seconds. So there is a challenge inside iMumz app, so that we celebrate the pregnancy in this much challenging times, and also thank the doctors who are there for us. So more than 40 doctors have come on iMumz platform so far in the lockdown, and they were there giving their time all every time and patiently answering all the questions. Even when after this live sessions, there are experts answering all your questions which are asked in the feed section. So we really owe it to them. So it's a small token of gratitude that sharing our expression of joy for being supportive in these tough times, also celebrating this wonderful phase of life called pregnancy. So please check out the challenge inside the iMumz app and share your gratitude with all of us, the iMumz family. We already received so many wonderful dance moves from you. I request you to continue that. I think we lost Dr. Madhuji's connection. So S. Singh, we couldn't take your question. Ankit Saraswatji, we couldn't take you. Divya Reddy, please post this question inside the iMumz app in the feed section. One of our experts will definitely get back to you, answer you these questions. So thank you so much, everyone, for joining this wonderful session. Have a great day. Thank you, Deepthi, for answering. Thank you. Yeah. This is the intention of iMumz, to make you stress-free and make this beautiful journey more enjoyable in this needed time. So please check out the challenge and share your dance moves with us. Sharing the dance. Oh, yeah. Luckily, we got Dr. Madhu Gulati ji again. Yeah, thank you, Ruby Mishra. Thank you. Yeah. So we'll take last two questions, doctor.
Yeah, sure.
Yeah, Ankit Saraswat is asking question. My wife is 30 weeks pregnant. Are there any tests or scans that can be done after color Doppler? Uh, do short height, that is 4 feet 10 inches, have any effect on the type of delivery?
It does have an effect on the type of delivery, especially in these modern days, because we normally don't squat, we don't do much sitting down. Earlier, in our grandmother's times, everything was done on the floor, right from cooking to swapping to mopping to washing. So their pelvises were more, flexible. But I'm sure your doctor will get another scan just before her delivery date to see the weight of the child, do a pelvic examination, and then decide which way she has to go forward.
Yeah, thank you so much, doctor. Next question. Divya Reddy is asking, ma'am, it is mentioned poorly ossified nasal bone. Do I need to terminate? Is her question. She
Actually, NIPT is normal, and sometimes, like NIPT is also 99%. If you get an amniocentesis done, that is also 99%. So your doctor will tell you better, and seeing into your history, your obstetrical history, and other things, whether you should get it terminated. But if I get your full report or you send it to the iMumz app, I'm sure Dr. Jaideep Malhotra, who's an expert, and will be able to tell you better whether you should need to terminate it or not.
Yeah,
But
so
your
good luck,
NIPT
Divya.
is not also, I would not really be very worried.
So good luck, Divya
Sometimes,
Reddy.
yeah, what are you saying, Ravi?
So sorry to interrupt, madam. I thought you finished the answer. That's
No,
why.
no, no. I would like her to send her reports to Dr. Jaideep.
Yeah, yeah.
She's an
So
expert on it.
Divya Reddy, we have you can consult Dr. Jaideep Malhotra ji one-on-one in the iMumz app. You can book a slot, one-on-one consultation slot with her, and if she's available, she'll definitely answer. If you priorly, book a slot with her. One last question of the day. S. Singh is asking, ma'am, really thankful to you. I was having water level issue in the 3rd month scan. Doctor recommended Foci GR to drink with water and Alamin M4 daily once. 28th week scan is fine. Suggest when to stop these medications.
I would
Doctor,
advise you to continue it till 36 weeks at least.
so her
36
doctor asked to stop after 32 weeks. So she's asking.
I think you could take it till 36 weeks.
Yeah. Okay.
Because you may not, have frequent visits to the doctor, so take it till 36 weeks.
Yeah. Thank you so much, Doctor, for joining us and sharing wonderful insights on managing one common element which many people are facing. And thank you so much, everyone, for joining. iMumz is here to, help you out maximum in your beautiful pregnancy journey. And with the help of experts like Dr. Madhuji, we are able to do it every single day. Thank you so much for joining, Dr. Madhuji. It was a wonderful
Thank
session
you
with
so
you.
much for inviting me. Thank you so much.
Thank you so much,
Bye-bye.
Doctor. Have a good day, everyone.
Bye-bye.